is a natural phase in a woman's life that marks the end of her menstrual cycles, which typically happens between the age of 45 and 55. Many will encounter a variety of physical and emotional symptoms. It can also be triggered by certain medical conditions. Menopause is not something to fear. With the right knowledge, support and care, you can move through these transitions with confidence and grace. And you should never feel alone in this journey. Hello everyone, I'm Dr. Anna Hu and I'm excited to invite you to a very special live sessions on the Anna Hu channel, Menopause and Hormone Restoration. So during these live sessions, I will be addressing your question in real time. This topic is close to my heart and I want every woman to feel confident, informed and supported as they navigate their health and well-being. Follow the Anna Hu channel for updates and I can't wait to see you there. Menopause is a natural phase in a woman's life that marks the end of her menstrual cycles, which typically happens between the age of 45 and 55. Many will encounter a variety of physical and emotional symptoms. It can also be triggered by certain medical conditions. Menopause is not something to fear. With the right knowledge, support and care, you can move through these transitions with confidence and grace. And you should never feel alone in this journey. Hello everyone, I'm Dr. Anna Hu and I'm excited to invite you to a very special live sessions on the Anna Hu channel, Menopause and Hormone Restoration. So during these live sessions, I will be addressing your question in real time. This topic is close to my heart and I want every woman to feel confident, informed and supported as they navigate their health and well-being. Follow the Anna Hu channel for updates and I can't wait to see you there. Hi everyone, welcome to Anna Hu channel. This is an educational space dedicated to sharing insights on wellness and medical aesthetic. I'm Dr. Anna Hu, the founder and medical director of Anna Hu Clinic, an award-winning wellness and medical aesthetic clinic based in the vibrant city of Kuala Lumpur, Malaysia. So today, topic is one that resonates with every woman, yet often come in silence, confusion and stigma. We are talking about menopause. This session's titled Understanding Menopause and How to Manage It aims to bring clarity, debunk some myths, and most importantly, empower you with the knowledge and practical tools to navigate this stage of life with confidence and compassion. Whether you are currently experiencing it, are approaching this phase, or are supporting someone who is, we hope you feel seen, informed, and supported today. So let's get started. Many still hold misconceptions about menopause. Some may think it only affects older women, that it's merely the end of period, or that women simply have to tough it out. But in reality, menopause is a complex hormone transition that can begin earlier than most expected. It impacts many aspects of a woman's health, physically, emotionally, and mentally. The fantastic news is there are safe and effective ways to manage symptoms, improve quality of life, and even thrive during this chapter. Because what I think is you truly deserve it. So now, let's make this interactive. It's time for our Ask and Win sessions. If you have questions about menopause, don't be shy, drop it in the chat, and you could win our complete essential kit. So what's in this amazing kit? NMN, 5 sachets to boost your energy and support cellular health. Collagen Forte, 4 sachets for the inner glow and skin firmness. Plant Pro Plus, 3 sachets for daily nutrition and gut support. It's packed with essential to help you look and feel your best inside and out. We'll announce 5 lucky winners tomorrow on the Anna Hu channel Facebook page, so make sure you follow us to stay updated. So quick questions for everyone watching. When you hear the word menopause, what's the first things that comes to mind? Is it symptom, age, fear, freedom, or something else? Drop your thoughts in the chat. Let's watch a quick explainer video to help us understand what is menopause and why does it happen. Menopause is a natural phase in a woman's life that marks the end of her menstrual cycles. It's officially diagnosed when she have gone 12 consecutive months without a period, which typically happens between the age of 45 and 55. So it is essential to remember that menopause isn't a disease or disorder. Rather, it's a biological shift where the ovaries gradually slow down and eventually stop producing 2 important hormones, estrogen and progesterone. These transitions occur in 3 stages. Perimenopause. This is the transition phase before menopause where hormone level begins to fluctuate. It can last several years. Menopause. This is a point when period stops completely. And postmenopause. This is a stage after menopause where symptoms may continue or gradually ease. Menopause is not something to fear. It's a natural part of aging. So remember, it's a journey that every woman experiences uniquely. With the right knowledge, support and care, you can move through these transitions with confidence and grace. So don't hesitate to speak with a healthcare provider to find what works best for you. And you should never feel alone in this journey. Welcome back! Let's recap what we just saw. What is menopause and why does it happen? Menopause marks the natural end of a woman's menstrual cycles and fertility. It occurs when the ovaries stop producing key hormones like estrogen and progesterone. Typically, these transitions happen between the age of 45 and 55, and even though it's a natural part of aging, it greatly impacts many aspects of a woman's well-being. Understanding this is important. Now, I would like to know how many of you feel confident in your understanding of what's normal during menopause and what's not. Feel free to share your thoughts or questions in the chat. We'll discuss them in just a moment. Let's dive into some common questions. Menopause only affects older women? Not true. The transition phase known as perimenopause can start as early as your late 30s or early 40s. Second myth, menopause is just about your period stopping. It's not true. It's way much more than that. Hormonal changes during menopause can influence mood, sleep, skin health, memory, libido, and so many other areas. Okay, let's keep those questions coming, everyone. Let's get excited in getting the new knowledge. Remember, 5 lucky winners will be receiving our complete essential kit in tomorrow's announcement. Now let's view the second video. Menopause is a natural phase in a woman's life that marks the end of her menstrual cycles. It's officially diagnosed when she have gone 12 consecutive months without a period, which typically happens between the age of 45 and 55. Menopause affects every woman differently. While some may experience just a few changes, many will encounter a variety of physical and emotional symptoms. Here are some common signs to be aware of: irregular or missed periods, hot flushes and night sweats, vaginal dryness or discomfort during intimacy, sleep disturbance, mood swings, irritability or anxiety, weight gains, often around the midsection, thinning hair and dry skin, reduced sexual desire, brain fog or difficulty focusing, joint stiffness or muscle ache. These symptoms can often begin during perimenopause and may last for several years. Recognizing these changes is the first step towards managing them with care and confidence. Menopause can happen naturally due to aging, but it can also be triggered by certain medical conditions. Here are some common causes: natural aging, which is the most common cause of menopause; surgical removal of ovaries. This can lead to immediate menopause; cancer treatment, such as chemotherapy or radiation therapy; primary ovarian insufficiency, where the ovaries stop functioning before age 40 due to genetics or autoimmune diseases. Understanding these causes help us recognize that it's a natural part of the life cycle. Menopause is not something to fear. It's a natural part of aging. So remember, it's a journey that every woman experiences uniquely. With the right knowledge, support and care, you can move through these transitions with confidence and grace. So don't hesitate to speak with a healthcare provider to find what works best for you. And you should never feel alone in this journey. Welcome back again. Let's discuss the causes and symptoms of menopause. Causes can include natural aging, ovary removal surgeries, cancer treatments, or even premature ovarian failure. Common symptoms involve hot flushes, mood swings, sleep disturbances, and even brain fog. So recognizing these signs early allows for effective management and early intervention. Now, let's address some common misconceptions. One of the myths: you just have to live with the symptoms. Or, this is absolutely not. There are numerous ways to manage menopause effectively, right from lifestyle changes and hormonal therapy to holistic approach. You don't have to suffer in silence. There are many things you can do to change the outcome. Another myth: menopause just means you will experience hot flushes. Okay, while hot flushes are indeed common, menopause affects the entire body, including mental clarity, emotional balance, sleep quality, skin changes, and even your sex life. Another common myth: hormone therapy is too dangerous to consider. Hormone therapy can be safe and beneficial for many women, particularly if started within 10 years of menopause onset. Always discuss your options with your healthcare provider to find the best approach for your unique circumstances. Okay, thank you so much for your thoughtful questions. So let's address the questions that we collected from the audience one by one. Number one, when we are looking from the audience from Madam Wong, do I need to remove my ovaries to relieve menopausal symptoms? The answer is no. You do not need to remove your ovaries to relieve the menopausal symptoms. In fact, removing the ovaries, which is a procedure known as oophorectomy, will actually lead to menopause due to significant decline in the productions of estrogen and progesterone. This can worsen menopausal symptoms rather than alleviate them. So in general, the management of menopause symptoms, typically it will involve a range of options, including lifestyle changes, hormone replacement therapy, and other non-hormonal treatments depending on the specific symptoms experienced by the patients. So it's essential to work closely with your healthcare provider to determine the best approach for your individual's need. Second questions that we have is, how long do menopausal symptoms like hot flushes usually last? And will they stop after some time? So in general, hot flushes are indeed a common symptoms of menopause. It's one of the common symptoms that the women is experiencing, and the durations can vary significantly from woman to woman. So on average, hot flushes may last anywhere from a few weeks to years, some even up till like 5 to 7 years, depending on the patient's health conditions. So many women find that the intensity and the frequency of hot flushes decrease over time. And for some, they do eventually stop altogether. Hot flushes are primarily caused by hormonal fluctuations, particularly the decrease in estrogen level, or the imbalance between the estrogen and progesterone level. Too high in estrogen, too low in estrogen, or too high in progesterone. So as women approach menopause, the ovaries gradually produce less estrogen. So this decline can disrupt the body temperature regulating mechanism locating in the brain hypothalamus, which leading to episodes of overheating of the body. So the hypothalamus, which is an area in the brain which control body temperature, may become very sensitive to slight changes in the body temperature. So as a result of hormonal fluctuations, this increased sensitivity can trigger hot flushes. While hot flushes can be frustrating, please remember that this is a natural transition. If the symptoms is overwhelming, hormone restoration can ease the discomfort. The other questions that we get from the audience is it normal to have trouble sleeping during menopause, and how long does this last? This is also another common symptoms presented by menopausal or perimenopausal ladies. Yes, it is normal to experience sleep disturbances during menopause. So we call this insomnia. So insomnia during menopause is commonly linked to hormonal changes and various physical and emotional factors. So the decline in the estrogen and progesterone levels again can affect the neurotransmitters in the brain that regulate sleep, which leading to difficulty falling and staying asleep. So this hormonal imbalance is one of the primary factors contributing to sleep disturbances during menopause. Besides that, another possible reason is because of night sweat and hot flushes, which many women experience night sweat and hot flushes, which can interrupt their sleep. So the discomfort associated with this symptom can make it challenging to settle down for a night or to stay asleep. Then we also know that hormonal changes can lead to mood swing like anxiety and depressions, all of which can make it harder to relax and to fall asleep at night as well. So psychological factors like stress or emotional distress, and which happen during menopausal or perimenopausal period, can significantly impact on the sleep quality as well. So establishing a calming bedtime routine and practicing good sleep hygiene can be beneficial during this time. If the conditions is worsened, hormone restorations can be considered. So it's good to discuss with your healthcare practitioner in regards of treatment for insomnia. Then the next question is, why do I often feel sad or emotionally low between the age of 42 to 50? Is this linked to menopause? Yes. feeling of sadness or emotionally low points during this age range can indeed be linked to menopause. So again, the hormonal changes that occur during this time, particularly fluctuations in estrogen and progesterone level, you will hear me talk a lot about estrogen and progesterone because these two are the main hormone that affecting menopause. And fluctuations of estrogen and progesterone can affect your mood. Additionally, life changes such as children growing up, career transitions, or even simply the aging process or endless to-do lists, all this can also contribute to this feeling. So it is important to acknowledge these emotions and seek support if needed. What are the best ways to reduce or manage hot flushes and night sweat during menopause? Managing hot flushes and night sweat can involve several strategies. We can work from the perspective of lifestyle adjustment, like staying cool and calm, wearing breathable fabric, practicing stress-reducing technique such as yoga or meditations. This can make a significant difference. We can also have some diet adjustment, for example, incorporating phytoestrogen-rich foods such as soy product, flaxseed, and whole grains, which may help in alleviating the symptoms. Not to forget about exercise as well. Engaging in physical activity not only improves mood, but can also help reduce the frequency and severity of hot flushes. And if natural way not helping, can also consider medical options. For example, hormone replacement therapy, HRT, and certain non-hormonal medications can be effective for many women as well. So again, when we talk about supplementations and medications, always consult with your healthcare provider for personalized recommendations. Another question is, are there natural or medical treatments that can help with sleep and mood issue caused by menopause? Yes, definitely. There are both natural and medical options to consider. For natural remedies, some women find relief with herbal supplements such as valerian roots or chamomile, which will improve on the sleep quality. Mindfulness practice like meditations and deep breathing exercise can assist in managing anxiety and improving moods. For medical treatment perspective, for more significant symptoms, healthcare provider may suggest hormone therapy, antidepressants, anti-anxiolytic medications, or other medications which tailor to support moods and sleep. If you have any other questions or would like to explore this topic further, please don't hesitate to reach out. Your health and well-being matters greatly, and together we can find the best approach for you. Now, let's have a look at the third video, Natural Way to Manage Menopause. Menopause is a natural phase in a woman's life that marks the end of her menstrual cycles. It's officially diagnosed when she have gone 12 consecutive months without a period, which typically happens between the age of 45 and 55. While menopause is a natural phase, its symptoms can sometimes be challenging, but there's good news as well. There are many ways to manage it, both naturally and medically. Lifestyle approach are the natural way. Eat a balanced diet rich in calcium, vitamin D, and fibers. Engage in regular exercise to boost mood, support bone health, and manage weight. Practice stress-reducing technique like yoga, meditations, or deep breathing. Quit smoking and limit alcohol intake to help reduce hot flushes and support heart health. Whereas medical options, for women with more severe symptoms, medical support may be necessary. Hormone replacement therapy. This replaces estrogen and progesterone to help relieve hot flushes and prevent bone loss. But it's not for everyone, so your doctor will assess your health before recommending it. Non-hormonal medication. Certain antidepressants or blood pressure medications may ease hot flushes and mood swings. Vaginal estrogen. This available as cream, tablets or ring to relieve dryness and discomfort. Bone strengthening medication for those at risk of osteoporosis. Treatments to protect bone density may be suggested. Menopause is not something to fear. It's a natural part of aging. So remember, it's a journey that every woman experiences uniquely. With the right knowledge, support and care, you can move through these transitions with confidence and grace. So don't hesitate to speak with a healthcare provider to find what works best for you. And you should never feel alone in this journey. Welcome back to Anna Hu channel. Managing menopause is essential, and remember, you don't have to navigate this journey alone or in discomfort. Here are some lifestyle changes that can help you ease your experience. Number 1, eating healthy. Incorporate food rich in calcium, vitamin D, and fibers, not to forget of essential fatty acid as well. Number 2, staying active. Regular movement can boost your mood, manage your weight, and protect your bone. Number 3, reducing stress. Engage in practice like yoga, deep breathing, or meditation. Journaling will help significantly as well. Number 4, cutting alcohol and quitting smoking. These changes will help reduce hot flushes and support heart health. If symptoms are more pronounced, medical support is available. For example, can utilize hormone therapy or hormone replacement therapy. It's effective for hot flushes and supporting the bone health. Number 2, non-hormonal medications. This can help with mood swing and hot flushes as well. Number 3, vaginal estrogen. This will relieve dryness and discomfort at the vaginal area. Number 4, bone protecting medications. This will help prevent osteoporosis. Every woman's journey is unique, so it's vital to consult with your doctors or healthcare practitioner about what's right for you. So with the right support and knowledge, you can approach menopause with strength, comfort, and confidence. Okay, now we look at another questions that we have. Do I have to face irregular menses when I coming to menopause phase? Yes, many women experience irregular menstrual cycle as they move towards menopause, which is referred to as perimenopausal period. So this phase can begin several years before menopause officially occurs and is characterized by fluctuations in the hormonal levels, particularly estrogen and progesterone. So during perimenopause, it is typical for menstrual cycle to become irregular. So some women may have shorter or longer cycles, experience changes in flow, or even miss period altogether. These irregularities are normal, and it's part of the transitions as our body adjusts to changing hormonal level. So if you're experiencing significant changes or any concerning symptom, it's a good idea to consult with your healthcare provider. They can help monitor your situations and check on your conditions, eventually provide guidance tailored to your specific needs. And let's look at the other questions that you have. Please don't be hesitate to send the questions to us, and then so that we'll be able to address if you have any concern. Now, let's look at the questions available. So far, the audience are quite cool and calm with menopause. Not many concerns that you have, yeah. So if there's no questions, then maybe we can talk about some of the questions that patients commonly asked during consultations. Like for example, during perimenopausal period, one of the commonest presentations that patients come to us is pigmentations on the face. And again, this increase in pigmentations on the face, it's also related to the changes in hormones in our body, especially in the case where there is imbalance between the estrogen and progesterone. So besides perimenopausal period, the other category of patients that will present to us with pigmentations challenges on their face, especially melasma, are patients who are on oral contraceptive pill. Because for this group of patients, there is disturbance of hormones in their circulations at the same time because of introductions of oral contraceptive pill. So when we are talking about the pigmentations on the face, so usually we will get the patients to reassess, is there any changes in their body besides the pigmentation, which to identify any potential risk of inflammations and what could be the cause of inflammations. And treatments with hormone replacement therapy and to off the oral contraceptive pill will eventually assisting in reductions of pigmentations. So again, melasma is one of the commonest cause or commonest reason for perimenopausal or menopausal ladies to come forward to seek for help. And another commonest cause or problem that faced by menopausal ladies are weight gain or difficult to reduce, or they might have difficulty in weight reductions due to water retentions. So gaining weight during menopause is a common concern, and this is not just about the eating habit. In general, it is largely influenced by hormones and the body metabolic process in the body, which will be able to address easily through lifestyle adjustment. Here is what happened for uncontrolled weight gain during perimenopausal period. Number one, it could be because of hormonal fluctuations. As estrogen level drop during menopause, our body try to compensate by storing more fat, particularly around the abdomen. So estrogen helps regulate metabolism and body weight. So when it declines, it can lead to fat redistributions from the hip and thigh to the belly. Second, perimenopausal or menopause, it also indicates aging process, which eventually leads to slower metabolism. Aging naturally slows down our body metabolism, which means our body burns fewer calories at rest. So even if we are eating the same amount of food as before, we might notice that the weight gained, it's difficult to control because we are burning lesser calories. Third, as we age, there is loss of muscle mass. With age, especially after 40s, muscle mass gradually reduces. Since muscle burn more calories than fat, losing muscle further slow down our body metabolism. Less muscle equivalent to fewer calorie burns and eventually leads to weight gain. And another potential factors like lifestyle factors, for example, midlife often come with changes in activity levels, stress levels, and the sleep will be affected as well. Less exercise, more sedentary time, higher stress level, which eventually increase cortisol, and poor sleep can all contribute to weight gain. So besides that, metabolic conditions like insulin resistance is common as we age as well. And this means that our body don't really process sugar and carbs so efficiently, and this eventually can lead to fat accumulations, especially around the abdomen area. Again, any solutions for that? What can we do? We can stay active with both cardio and strength training to maintain muscle and burn calorie. So cardio exercise generally will help to burn more calorie, whereas the strength training will help to increase the skeletal muscle mass. Besides that, we can eat balanced meal, focus more on protein, fibers, and healthy essential fatty acid. Not to forget to manage stress, which is an important element in lifestyle adjustment, because stress management through relaxation technique, hobbies, or counseling will assist in reduction in utilizations or stimulations of cortisol. Sleep quality, sleep hygiene is extremely important. Quality rest will help to regulate hunger's hormone, reduce the desire to eat, or to increase the craving for sweet and salty food. But most importantly, if you have any concern, talk to your healthcare provider about any concerns that you have, so that while we might think that the issues could be because of menopause, sometimes it could be because of other related medical conditions. For example, thyroid issue also can lead to weight gain, especially in hypothyroid conditions. All right. So now let's look at the questions that we have. One of the question is, do we ever feel better after menopause? Yes. Once the hormonal imbalance settles down, when both estrogen and progesterone at the lower level, without the fluctuations, many women feel better after menopause, especially symptoms like hot flashes, mood swing, and irregular period stop, because there is no hormone imbalance. Some also feel a sense of freedom from monthly cycles and worries about pregnancy. However, it depends on overall health of hormone balance and lifestyle, where personally, I would think that to maintain a balanced hormone is important. To maintain certain amount of effective levels of estrogen and progesterone in our circulation is also extremely important, because estrogen and progesterone not only supporting our fertility process, pregnancy, it's also extremely important in the perspective of brain health, how the brain functions, confidence level, the ability for an individual to experience joy, the reductions in irritability, anxiety, and anger. Okay, so some may continue in menopause. Some may have symptoms like vaginal dryness or joint ache. In this context, estrogens also play a significant role in maintaining the moisture of vagina in the vaginal area and the health of the joint at the same time. So as women's age, postmenopausally, we do notice that the chances that an individual having vaginal dryness, which eventually leads to infections and reductions in libido, painful intercourse, the incidence rate is increasing after the menopause. So, at what stage is menopause the worst? Generally, this is depending on individual as well. So the worst stage for symptom is usually perimenopause, which is the transition phase before the menopause. And during this time, it's often starting in the mid to late 40s, where estrogen level fluctuate a lot, which leading to hot flashes, sleep problem, mood changes, and irregular periods. So once menopause is complete, which as what you have viewed from the video, 12 months without a period, those symptoms often improve or reduce over time. So the reductions in symptom generally is because of the reductions in imbalance between the estrogen and progesterone. So another questions that we have is, does early menopause indicating poor health? Again, when we are talking about menopause, generally the cause of menopause, it could be genetic inclined, in the sense that generally if your mothers or your sisters have an early menopause, somehow you might have the similar conditions as well. So early menopause doesn't always means poor health, but it can be a sign or a risk factor for certain health concern, depending on the cause and how it's managed. So early menopause generally refers to menopause that occur before the age of 45. While premature menopause happen before age 40, it can occur naturally or be triggered by surgery, medical treatments, chemotherapy, or some diseases like autoimmune conditions. So it's important, if early menopause is present, we would propose for the women or the ladies to seek for medical assistance to identify what could be the reason which leading to the early menopause. And let's look at so in our practice, day-to-day practice, we do notice that some patients presented with irregular menses during the early menopause phase, for example, before the age of 45. And sometimes during the assessment, we notice that the patients have significant inflammations and nutrition deficiency. So by restoring the necessary nutrition, especially the essential fatty acid, and reductions of the patient's inflammations, eventually patients will be able to regain back their regular menstruations. Another questions that we have here is, any preventions that we could do before approaching menopause? Oh, this is also one of the commonest questions that patients ask as well, especially for those patients that around the age of 40. So yes, definitely, there are many things that we can get ready prior to the menopause time. For example, number one, to practice healthy lifestyle. So for example, one of the important healthy lifestyle is to eat enough nutrition to support the body. As what we know, estrogen and progesterone are cholesterol-based hormone. So for the body to have sufficient amount of estrogen and progesterone, it is important for us to have sufficient amount of good fat. By doing so, what we can do is we can specifically select healthy fat while we prepare our meal daily. Besides, to have sufficient amount of protein is also extremely important, and to get enough fibers in the diet is important as well. Then when we are looking at another questions that we have here, if someone in perimenopause has estrogen dominant conditions with a disease, should the person still take estrogen replacement? Oh, The answer is definitely no. So again, when we are talking about perimenopausal period, it's a phase of life where there is imbalance in estrogen and progesterone. And most of the time, the commonest conditions is elevating estrogen level and reductions of progesterone. As what I always share with patients, progesterone is a calming hormone. So the more stressful we are in our daily activity, the amount of progesterone being utilized in our body will increase. So if we are constantly having endless to-do lists or under great stress, eventually the progesterone level in the body will be very low. And in that context, it might eventually leads to estrogen dominant. Besides, there are many ways that will eventually lead to estrogen dominant. For example, increased intake of the processed food, constantly drinking water from the plastic container, and constantly or utilizing certain type of supplement which contain high soil or high yam content. And all this eventually will lead to estrogen dominant. If estrogen dominant is the main situations that we are facing, the treatment option is not for hormone restorations, but to identify the root cause of estrogen dominant and to assist the patients in eliminating excess estrogen so that we will bring back the balance of hormone for the patients. Another question that we have here is there a way to delay menopause? Generally, there is no guarantee way to delay menopause because it is largely determined by genetic and natural ovarian aging. However, certain lifestyle factors are linked to earlier or later menopause. So maintain a healthy weight. It's important. Extreme underweight or frequent yo-yo dieting can lead to early menopause. Besides, it's advisable to not smoke. So avoid smoking is important. Smoking is strongly linked to early menopause by 1 to 2 years. And eat a balanced diet is important. Adequate nutrition will support ovarian health, especially good amount of essential fatty acid and good amount of protein is important. Exercise regularly will also assist in hormonal balance. Exercise too intense without enough nutrition may eventually lead to early menopause. Not to forget as well, stress management is important. Chronic high stress may indirectly affect hormonal health over time. So by doing or practicing what we preach as healthy lifestyle, which will eventually assisting in healthier body, and hopefully it will assist in balance in the hormonal status in the body. So in summary, while you cannot fully prevent, I think no one can prevent menopause, living a healthy lifestyle may support our ovaries to function well for as long as naturally possible. Genetic, however, remains the biggest factor when you will attain your menopausal period. Okay, I think, is there any other question? So we have a question here. Does menopause cause trouble sleeping? We have answered this question before this. Maybe you can revisit the initial questions that we already answered. So another question is, can take hormone replacement? Yes, hormone replacement, hormone restoration therapy is one of the treatment options for menopausal or perimenopausal ladies. So if you have concern in regards of menopause, please don't be hesitate to visit your healthcare practitioner. By proper assessment and lifestyle assessment, not only by proper assessment in your lifestyle and in your symptom and assessing your physical conditions, your healthcare practitioner should be able to assist you in treatment planning for your menopause concern. And let me see. What are the most underestimated or overlooked support you believe can truly help women like me during menopause? I think for this particular questions, maybe I can give you a bit of more detailed answer in the next Facebook Live. So stay tuned, because there are many things that we are able to assist and patients, not just by giving the suggestions, because proper assessment and proper understanding of the patient's conditions will be able to allow us to assist a more personalized treatment for the patient. So another questions that we have here is talking about what's the what signal the end of menopause? Generally, I don't think that is the end of menopause. Menopause is just indicating that an individual, a woman, no longer have period, and the body already depleted the resources to produce estrogen and progesterone. So the moment when there is cessations of menstruations, more than 12 months, the patient is attaining menopause. So menopause is a condition which will last for many years. Another question that we have here is, after hysterectomy, will it cause menopause? This question a bit similar with the questions that we have, the first questions that we have. So hysterectomy are removal of the uterus. If it's only involve removal of the uterus, generally the patients will be able to still remain the estrogen and the productions of estrogen and progesterone from the ovary. So only oophorectomy will lead to menopause. Removal of uterus, hysterectomy without removing ovaries will not lead to menopause. However, removal of the uterus, because there is no existence of the uterus lining, so post uterus removal, hysterectomy, generally patients will no longer have periods. So patients do not enter menopause immediately, where the ovary will still supply the estrogen and progesterone. So the patients will not experience the perimenopausal symptoms like hot flashes, insomnia, or mood changes, but experience the cessations of menstruation. So if there is no other questions, let me check. If there is no any other questions, maybe we have come to an end for today. And thank you very much for watching. And Please don't forget to subscribe and tune in to the next episodes for more health insight. Next episode, we will rediscuss about dyspareunia, which is one of the topic which we have discussed 2 months ago, which many patients request for a repeat sessions. So stay healthy and informed. Always remember, you deserve to stay at the optimal health state to live a more fulfilling life. So goodbye for now. Bye.